3 COVID-19 patients have been discharged this afternoon after testing negative twice. The public hospital, meanwhile, states that the current test kits are only reserved for specific individuals.
The 11th patient discharged is a 31-year-old Filipino non-resident worker. He returned to Macau from Manila on March 16 and was confirmed with the disease on the 18th. After receiving treatment for 26 days, the patient is deemed appropriate to be discharged. His total treatment fee amounts to 18,000 patakas. The 12th patient discharged is a 27-year-old local man. He arrived in Macau on March 25th from New York City and remained at the hospital for a total of 19 days. Meanwhile, the 13th patient discharged is a 47-year-old Spanish tourist. He arrived in Macau on March 16th from Spain after making layovers in Russia and Beijing. He stayed at the hospital for a total of 28 days and will be billed 44,000 patakas for his treatment. All 3 patients have been tested negative twice, Thursday and Saturday, respectively, and will be arranged to undergo a 14-day recovery quarantine period at the Public Health Clinical Center. According to health authorities, Macau's hospital has mainly prescribed 2 types of drugs in treating COVID-19 patients, those that are typically used to treat AIDS and malaria. He believes these 2 drugs have been effective in facilitating patients' recovery. But to be on the safe side, patients must be asymptomatic and maintain a continuous negative test result before proceeding to the second recovery stage.
We don't just look at the recovery process when considering discharges. We have to also look at the duration of the blood test. Based on recent cases, it takes 3 to 4 weeks to maintain a negative test result, so we're not rushing to shorten their hospital stay. Of course, some symptoms do recover quickly, or maybe some do not show obvious symptoms at all during the whole process. But to be safe, patients must maintain a negative test result before proceeding to the second stage of recovery.
On the other hand, the medical director clarified that the current test kits are only reserved for suspected and confirmed patients, close contacts, and returnees from region of high incidence. But private companies are now preparing to provide third-party blood test services to regular residents in Macau. He said authorities would extend their support for enterprises that are deemed qualified.